Our presentation is based on access to healthcare by older adults. Ideally, all Americans should have equal access to physicians, hospitals, and medical tests in their communities. The fact is that large disparities exist in access to healthcare services based on race, ethnicity, socioeconomic status, and education. The elderly and low-income individuals are more likely to experience various obstacles to receiving quality healthcare services. One-fourth of older adults have no supplemental insurance coverage for their healthcare needs. Preventive healthcare screening rates are particularly low for minorities and low-income adults. Older adults experience the effects of healthcare disparities more dramatically than any other population group. They are particularly at risk because they are more likely than younger people to have chronic illness and make frequent visits to medical facilities. They also live in poverty. Certain barriers have been identified as limiting to healthcare access by seniors. This include transportation difficulties, limited healthcare supply, lack of quality healthcare, social isolation, and financial constraints. 6 diverse coping strategies that have been discussed in dealing with the cost of prescription include the reduction of dosage or doing without prescription. They limit other expenses in order to avoid prescription. They rely on family assistance in order to afford quality health care. They supplement with alternative medicine. They shop around for cheapest prices. A fifth of seniors use Veterans Administration to afford health care. Paying for health care is a problem for most seniors. The health care for seniors is largely paid by Medicare and Medicaid. Medicare requires every senior to be insured or pay a penalty. All older adults aged 65 and more are covered by Medicare. Medicare offers limited choice for seniors. Seniors may also be limited on health care providers because only a certain number of physicians or providers, healthcare providers, can take Medicaid. There are no out-of-pocket payments for residents.
Aging adults that live in rural areas have the greatest difficulty finding healthcare providers that will accept them as patients. There are very few doctors that practice in rural areas and accept Medicare too. Many times these people must drive great distances in order to get the care they need. Aging adults that live in urban areas have a less difficult time finding providers, and for the most part are able to find a good doctor that accepts Medicare. The specialized services that is targeted to the specific needs of an aging adult is a good gerontologist. There are 18 doctors in Utah that specialize in geriatric medicine. The majority of these doctors practice in the Salt Lake area, making access for rural populations even more difficult. As for the older adults that do live in Salt Lake area, they have easy access, but there is a limited amount of doctors serving a large population of older people. Long-term care facilities are also a specialized service for this group. A study by the U.S. Department of Health and Human Services says that people who reach age 65 will likely have a 40% chance of entering a nursing home. About 10% of the people who enter a nursing home will stay there for 5 years or more. So living in a long-term care facility is a reality for many aging adults. A lot of those aging adults that live in long-term care facilities must spend down their assets enough to qualify for Medicaid because Medicare doesn't provide the coverage they need. Overall, the health of aging adults is positively affected by the current healthcare system because without the current system, our aging adults would be even worse off. But there are many improvements that can be made, and many aging adults fall through the crack of the Medicare system. A family should not have to spend down all of their assets in order to get the coverage they need. Our grandparents, great aunts, and great uncles should not have to sacrifice their financial future in order to get the care. Aging adults need better health care, and as a society, we should be willing to provide this. Let's help make their golden years truly golden, because one day we will be in that position, and what services would you want available to you?